Hello.
Hi! Yay! Happy Halloween! Is it 31st September? Yes, it's tomorrow! Yay! Happy Halloween! Let's wait for more people to dial in.
Hi. Okay, so basically today our topic will be
Diabetes.
diabetes.
Yeah.
Very dry topic.
Yeah, so we're gonna hype it up a little bit. Okay,
Yeah.
Henry, tomorrow is Halloween.
Mm.
If you have a chance to dress up, what will you dress up as?
Money heist, one of the robber.
Huh?
Yeah. If you have watched that show.
No.
Oh, you don't watch the show.
What is it? What is it like? What kind of robber is that?
Basically a patient. Basically the robbers, they wear a very simple onesie orange color thing,
And then?
and they wear a mask lah.
Wear a mask and then?
That's it lah. And they hold a gun. It's very popular right now.
Really?
Yeah.
It's a movie or what?
It's a series.
Series.
Netflix.
Okay.
Yeah. Right.
And is he a successful robber or is the Mr. Bean type that is like always mess up? And,
I think we shouldn't talk about it lah.
It's spoiler, right? Spoiler. Oh yeah.
Correct.
There's someone. Oh, there's so many people
Hello.
watching now.
Right,
yeah,
thanks.
actually I have bought these props for Henry to wear, but he doesn't like to wear. So I had to wear. Yeah.
Have a bit more serious at the same time, a bit funny lah. So.
So I had to wear it. Yeah.
Yeah.
Okay.
So.
Okay, let's wait for more people to dial in. So
Okay.
usually what do you do during Halloween? Oh. Let's wait a minute.
You talk.
Oh yeah. Okay. Let's see.
You check on the patient. I think basically sekarang ada muntah lah.
Dali mask. Roy said Dali mask.
Oh, it's called Dali mask, is it?
Is it Dali mask?
Don't know.
Don't know what is that. I thought Dali is like 黑人牙膏, you know, the Dali toothpaste. Okay, wait. So do you usually celebrate Halloween? No, right?
Not so much.
Party? No.
No.
Or have you ever dressed up in a character before for any Halloween event for the past years?
No.
No. Why? You're not that type.
No.
No. Or you went to some horror house?
Yeah, horror house. Yeah.
Universal Studio, etc.
Yeah.
Are you scared by this kind of thing?
No.
No,
Not scared.
So you're not scared of horror movies. You're not scared of all these things.
No.
Oh, that's good, man.
Yeah.
I'm scared of all these things. I don't like horror movies, and I don't dare to step into these kind of places.
Okay.
Yeah.
Okay. Come. Should we wait a bit longer?
Let's see. Let's wait for a while more. That is quite a dry topic for today, diabetes, but it's one of the most serious disease that we have seen in Southeast Asia. I think in Asia in particular. Okay, I'm gonna wait.
Okay.
So maybe we can start first on this topic. So welcome everybody to our Wednesday afternoon. It's gonna be lunchtime soon. So thank you for joining us today.
Correct.
So we'll be
Welcome.
talking about diabetes.
Okay.
Yeah.
So before that, remember to follow the Facebook page, subscribe and like, and turn on your notification if there is lah.
Yeah.
There is. Okay.
We do have on YouTube. We have YouTube channel also. Yeah.
Hello. Okay. So basically, right, today's topic will be on diabetes lah, or 糖尿病. So when we talk about diabetes itself, they will be basically we think about high sugar content in the blood level itself. So there is actually two types of major diabetes itself. One is type 1 and one is type 2. So basically when your relatives, they all say they have diabetes, usually majority of it would be type 2 itself. So type 1 usually happens in very young ages itself. Yeah, so and when type 1 happens, usually they are around adolescent or teenagers time lah, and they will be on insulin injection. So today we talk more about type 2 because they are more common, and I'm pretty sure a lot of people will have a lot of questions about them lah. So type 2 diabetes, so what is diabetes? So diabetes is a condition where your body has a high sugar level, higher than normal. So how this thing occurs itself is usually because our body cannot control the sugar level. How we control sugar level is by this thing called insulin. So this insulin, right, is a hormone. It's a chemical that's being produced in our body by this organ called pancreas. If you're not so sure what pancreas is, it's called 胰腺. So you can look it up lah, because we know stomach, we know heart, we know kidney, but we don't know what's pancreas. So it's situated right behind our stomach region, and that organ is very important. So that produces insulin. So when diabetes happen, alright, so insulin right now it's being produced, okay, but then our body is not utilizing it properly. So that might cause insulin resistant one. Or another condition where our body is not producing insulin, and that's why our sugar will be high. So let's say, for example, me and Joyce, both of us were to drink Coke, for example. Okay, let's say, for example, she doesn't have diabetes, I have diabetes itself. So she drink Coke, I don't drink Coke. We can drink a few bottles at one go, and about 2 hours later, we can take our blood and we can check our blood level. So let's say for Joyce itself, right? So Joyce didn't have any problems. She has no diabetes. Her insulin will recognize that there's very sugary, sweet stuff in the body, and they will try to bring down the sugar level by bringing it down lah. I won't explain how. So for me itself, let's say I have diabetes itself, I won't be able to have produce enough insulin, or my body cannot utilize this insulin to bring down the sugar level. So it's very simple. So basically, how a person has diabetes is the person just can't control the sugar level lah. Yeah, later I will answer the question. Hold on. Okay, so that's basically diabetes type 2. Okay, so what are the causes of diabetes itself? Okay, so there's two major causes also. One is genetic, and one is lifestyle. Okay, so genetic wise is, of course, if your family history has diabetes level, has diabetes disease itself, like parents or grandparents, there is a small chance that you might get it. So that's genetic. It's hard to explain why, but it's just genetic. Second is lifestyle. Yeah, so lifestyle wise, like a sedentary lifestyle, which means you're very inactive, you don't exercise at all. Another one is weight gain. Let's say you're very obese, smoking, alcohol, being old itself, more than 45 years old, is also a risk of getting diabetes itself. Being pregnant can get diabetes itself. Having this thing called what do you call that? Metabolic syndrome is not you get one. It's something else. Later I'll explain about metabolic syndrome. High blood pressure, and also this thing called polycystic ovarian disease itself can cause diabetes itself lah. Also, okay, what are the symptoms to look out for? So after I say causes, the second one is symptoms. So symptoms wise, let's say if you have any friends or yourself itself, you are very thirsty most of the time. You just keep drinking water. Alright. Second, we call that polydipsia. Okay. Polyphagia. What is polyphagia? Is where you just very hungry. You just constantly always hungry. And polyuria is where you keep wanting to go to toilet, keep peeing. If let's say you have these three symptoms itself, right, it's good that maybe you should ask your friends or your family members to go and see your doctor. Okay, then alright, then decreasing in weight, unexplained, that's one. Being fatigued easily, you're just always tired. It can be also symptoms lah of having diabetes itself lah.
I just want to add on, in terms of the genetic, you mentioned that someone, like if there's anyone in the family that have diabetes, high chance you may get it. But when I look through, yes, I'm Joyce, the dietitian. People are asking who is this? Yeah, I'm Princess Joyce. Yeah. So in terms of genetic wise, why is it some people tend to get diabetes because of family history? It's because when we look at research, when the child is in the stomach, like baby, and if the mother had diabetes, then the child is exposed to high sugar level inside the uterus. High chance the baby will develop some insulin resistance, which they will carry it to adulthood. So the chances of them getting diabetes will also be higher lah. So it's this exposure in the uterus during pregnancy. Yeah, high chance the kid will have diabetes later on lah. Yeah. Okay, sorry, can continue.
Yeah. Okay. So that's okay. Later we will add more about nutrition stuff and stuff. Okay, then of course one more thing, slow healing wound. Let's say for example your family members has very slow healing wound itself, just doesn't get well. You might want to go and see a doctor too lah. Okay, so what's wrong with having high sugar? You'll be asking why high sugar can affect the body, man. So if let's say for example your wound itself, you have high sugar content, your blood is a bit sweet, it will create in a very good place for the bacteria to grow. It can also causes slow healing. Why? Because it's very sweet, increase in bacterial growth. That's why the wound itself is just taking very long to heal, and that can be a problem. So it can be from small wound itself become a big wound, and that's how people lose their foot.
Because of gangrene, right?
Yeah, gangrene. Yeah, correct. Then so the complications. Yeah, so there's two major types. So micro and macro vascular complications lah. So I will just make it easy. It can cause you to have heart diseases. It can cause you to have you lose your foot, cause skin problems. It can cause you to have nephropathy. Nephropathy is where your kidney will be damaged and you need to go for dialysis. Retinopathy, you can cause you to lose your vision. It can cause the nephropathy. Nephropathy is the kidney problem like I just said, and this thing called neuropathy, which is where you have nerve problems where your body will have tingling electric shock sensation in your arms and legs lah. We call it the gloves and leg stockings lah, where you just feel numb because your nerves are dying because of the high sugar content. So that's also one of the complications lah. So nerve problem, kidney problem, heart problem, skin problem, eye problem, heart problem. So a lot of problems lah. And you can ask yourself why people are having dialysis. If people are in dialysis, it's because their kidney is not functioning anymore. So when the kidney is not functioning anymore, usually one of the few causes is also diabetes. It can be the kidney.
The most common one.
Most common ones lah. So for hypertension will be stroke. For hypercholesterolemia will be heart problem. But dialysis wise, usually it's caused by diabetes. But of course, there's many other causes lah. Alright, so one more complication is called GDM, which is the gestational diabetes mellitus, which is mentioned by you lah, in pregnant lady. So pregnant lady itself, right, can have a very high risk of having diabetes, high sugar content.
And that's why every time when they go for checkup, doctor will ask them to do like urine tests, right? Just to make sure that their sugar level is not too high.
Correct.
Otherwise, usually if it's too high, then what will the doctor do?
Then they will make the patient go for this thing called a glucose tolerance test, also known as modified glucose tolerance test lah. So they will ask the mother at a certain period of the gestation, which is about 20 weeks. They will ask them to come over fasting for 8 to 10 hours. They will take their blood. Okay, then after that, then they will let her drink this very sugary drink. So very sugary, they drink already.
More sugary than bubble tea lah.
Yeah, it's very sweet one. Okay, so then after that, then they will take the blood again 2 hours later. So you have two blood samples. One is the fasting one, one is after
2 hours.
drinking the 2 hours one. So both of these cannot be more than 5.6 for fasting, 7.8 for the post sugar drink. So if any of these levels is higher than that, you have diabetes. No, you are at risk, or you have diabetes lah. We call it GDM.
We also use it for those people that are not pregnant. We also use this fasting and also the 2 hours glucose tolerance test.
Correct.
Yes.
So that's how they diagnose GDM lah, diabetes lah. So let's say if it's high itself, then they will first step they will ask the mother to go for diet control.
Have to.
And that's where you come in.
Yes. Diet control.
A lot of things they will ask.
Must come and see me.
Correct. Then let's say if it's still not controlled, then mother cannot take the medication. They have to take insulin. Yeah. So why GDM is bad for the mother and the baby is because it can cause a few problems. One, if it's too high in sugar content, too high in sugar in blood, it might cause the baby to be too big. Then the baby cannot come out. Need operation.
Yes.
Second, it can cause baby to die in the mother's womb itself. Cannot be explained why, because too high sugar, the baby might die also. Then these are the bad things about it lah.
And also the higher chance of developing diabetes in the future lah. Because the baby is exposed to very high sugar content or level inside the uterus. So when the baby is delivered, high chance when the baby reach adulthood or even teenage, they may have a chance of developing diabetes. And the mom also, right, after they deliver, usually the sugar level in the blood will go down. But in the next 10 years, they will have a higher chance of developing diabetes compared to the usual people.
Correct. Yeah, like you said. So let's say if your wife or your mother had GDM during pregnancy itself, there's a significantly higher risk of getting diabetes after delivery. Yeah,
So
correct.
they still have to take care of their diet and their lifestyle after delivery.
Correct.
Yeah.
But of course, mother or females having GDM, diabetes in pregnancy itself, doesn't mean they will be diabetic after that.
Yes.
Yeah, it's just a condition which happens during pregnancy. So that's why everyone should take care of themselves.
Yeah.
Okay, then we talk about investigation already, right? Then we can now talk about treatment. Okay, so usually, let's say for example, someone has diabetes itself. So how do we treat the diabetes level? Okay, so first, lifestyle. The doctors will definitely ask you to go for lifestyle changes, no more sugary stuff, because exercise. So because everything, let's say for example, you'll be asking doctor, if I don't take any sugary stuff, wouldn't my body go to this condition called hypoglycemia? But I'll tell you, let's say you don't take any sugar stuff. Let's say your kopi is kosong, your teh is kosong. You don't take any sugar at all. Your rice your meat your vegetables
All your deep fried food.
all will have a bit of glucose inside one. So there's no reason why you should go into hypoglycemia.
Because your body can convert other sources of food into sugar also.
Yep. Then also there's lifestyle changes stop smoking don't drink alcohol. Exercise wise is best maybe at least 3 times a week, more than half an hour, high intensive, heart rate should be more than 120. That's considered exercise.
Really?
Yeah.
Heart rate more than 120. I don't really measure that. I just felt that as long as you exercise or whatever, you go dance, cycle, walk, swimming, it's better than just sitting down. Any part of exercise, as long as you're moving, it's good for you.
Because why I mention it, because a lot of people say, no, because doctor, I housewife, I work, I clean the house. I work, I'm an engineer, I walk around and stuff. But those are not really considered exercise. To be exercising itself, why people wear watches to monitor their heart rate? Why all those machines in the gym has a heart rate monitor? It's because they want to let you know that now, if the heart rate is more than a certain level, you're actually at the peak of burning fats.
I understand.
So when you rest itself, your heart rate dropped to 80, it's time to not rest, continue. So if you can maintain the certain heart rate, about 120 okay, for more than half an hour, that will be the best. So like you mentioned, aerobic like you mentioned,
swimming,
cycling, all this will be very helpful Yeah.
Or if they are not sure how to measure the heart rate, if they don't have the resources to get the watch, then as long as they are breathing slightly heavier than usual, then that will mean that your heart is actually pumping harder than the normal one, means that you are most likely exercising
Yeah, that
Okay.
can be it.
Okay, so besides lifestyle changes, then the medications.
Okay, then followed by treatment So treatment wise, there will be 2 major things. One is the OHA, oral hypoglycemic agent, which is basically a 糖尿病药 tablets.
To reduce your
to
sugar
reduce
level.
sugar level. The one you have to make sure you follow the doctor's instructions Then second will be the insulin. Insulin 就是胰岛素. Okay, wow, this question good. So insulin a lot of people think 打 insulin 不好，打 insulin 会有问题 but of course if you compare insulin and oral medication insulin actually is way more safer because it doesn't cause kidney damages. It doesn't damage your body It basically
no side effect
side effect, there is side effect, but the thing is side effect has to be monitored through the dosing. The doctor will tell you how much to be given and your self-monitoring of your sugar level. So that's basically one of the major few side effects. But other than that, it will not cause damage to you if done properly. It's just painful, yes, but the needles are very small.
And it's not very convenient also because you have to store it in the fridge, right?
Yeah.
So if for people that are always on the maybe site visit, for example, they are always outside, it's not convenient for them to bring the insulin out because it needs to be in the refrigerator.
Oh no, but there's new advancement now already. You don't the insulin pens they come in disposable and you don't have to store them into the fridge.
That's the old insulin.
Those are old ones.
Yeah.
Now it's so advanced that the pen itself, right, how it comes like this, you just open up the cap, then you just adjust to how much you need, inject. Okay, that's it, done. Then you can just store it and just keep your insulin pen. Then you can use it until you finish, then just throw away, buy a new one.
But I need to keep it in a cool place. cool place.
In the room temperature.
Room temperature is still okay lah.
Correct, correct.
And we also have to see your injection technique, right? Make sure you know how to inject properly.
Mm.
Because I do know some people, they say, oh, I inject with insulin, but it's still not going down. But you realize later they don't know how to inject it properly. So the technique of injection.
It's important, yeah. Correct.
You teach them usually?
Yeah,
you
we
teach
do.
them.
Yeah.
Okay, so our clinic, we do teach them.
Yeah, correct. So it's very simple. It's very scary, but it's the best. If comparing to which is better way of controlling your sugar, insulin is definitely better.
But usually, do you advise for insulin first, or do you go for the medication first?
Medication.
Okay. So
Nobody wants to inject themselves.
Oh yeah, it's painful lah.
It's painful.
Yeah, and it's more expensive than medications. Is it more expensive?
Not really now.
Not really. Oh, comparatively
maybe a bit more expensive.
Slightly more, but more effective lah.
Yeah. But there's a lot of type of medication now. It can be more expensive at times for the tablet wise. But of course everybody will opt for the medication.
It's not painful.
Yep. Correct.
Okay. So in terms of medications, usually what are the few medications? A lot.
I don't think anyone here will understand.
A lot. Okay. So usually metformin will be the first one that you recommend people.
Yeah. So Biguanex is one of them. So metformin is actually one of the most common type of OHA therapeutic medication. Then there will be glycoside there will be SGLT2 DPP4 many types But you don't need to know this. But your doctor will explain to you. Yeah, actually
And they will use it. They will look at how high is your sugar level, and then they'll prescribe the medication accordingly
Correct.
Yeah.
Right. So we have finished the treatment wise. Okay. So now we will go to diet part.
Yes.
The most important part.
Diabetes. Okay. Diet part. I have to emphasize is very, very, very important in terms of diet. In many other countries, especially in Western country, like you have Australia, US, Europe, even Singapore also. Usually, if people have diabetes, the first person they will ask to see will be the dietitian, because dietitian will advise you have to have a lifestyle change, especially your diet, because you can take medications, you can go for insulin injection, but if you don't take care of your diet, one day all these medications and insulin dosage will be maxed off. You'll max out all the amount, and your kidney, everything will just fail, because we do know medications will have a lot of side effect, and sometimes if your kidney reaches the point where it's so damaged, some medications is not suitable at all. So diet wise, usually for the younger people, nowadays we do see a lot of diabetes in a lot of young people, teenagers. We see them in their teens, 16 or 17 years old, having diabetes, and even in adults also. This used to be a disease that affect maybe middle-aged people, like 40s or 50s. Nowadays we see a lot in young people, because their lifestyle is not ideal. They are always sitting down in front of the computer, not moving. They call a lot of like fast food, takeaway food, delivery. So diet is you're nodding. Your favorite, right? But you do exercise, right? So
regularly.
He exercise regularly, so his sugar level is okay. So for people who don't really exercise and find it very difficult to exercise because of their work, or because they are so committed to other things, diet must be the first choice of preventing or even managing our diabetes. So in terms of diet wise, a lot of people, they do come and see me, and then they tell me, I avoid rice, I don't eat like all those starchy food anymore, and I don't eat anything after dinner, but still my sugar level is still high. Actually, we do know that our sugar from our blood, other food will also convert into sugar. So if you take a lot of fast food, deep fried food like fried chicken, nuggets, all these things, our body can actually convert this into sugar, but it just takes a longer time. Like if instead of a starchy food, it's just one way, it becomes sugar. If you take like fatty food, for example, it takes a longer way to convert to sugar, but it's still sugar in the end. So usually I'll tell people, you don't have to avoid carbohydrate. So carbohydrate mainly comes from your rice, noodle, bread, chapati, biscuits. You can control the amount. If you usually take one bowl of rice, you can maybe cut it down to half. The portion, you make it smaller. And then if you have a choice of choosing white rice and brown rice, ideally you should be choosing brown rice or even basmati rice, because this rice take longer to digest, so the sugar don't spike up that fast. Okay. So you can cut down the amount of rice, but you don't have to avoid completely.
Mm.
Yeah, and if you take like maybe bread, you can choose wholemeal bread instead of white bread. And then if you take noodle, you can cut down the portion size, maybe take lesser, but then you don't have to avoid completely. Yeah, but definitely I'll tell people if you can have 3 main meals, regular timing, that's the best. Yeah, so because some people they will have like a very big breakfast and then they'll skip lunch and they go for dinner. You can imagine after your breakfast, that big breakfast, your sugar level is going to spike up very high because of the amount of carbohydrate that go in. Yeah, and then at lunchtime when there's no food going in, you can imagine your sugar level suddenly slumping very down. So it's like a roller coaster, going up very high and then you go down very fast. Yeah, so I'll tell people it's better to have 3 main meals a day. Ideally, the gap between the meals should be about 4 to 5 hours.
Okay.
So if you have your breakfast at 8, by 1 p.m. you should be having your lunch.
Okay.
And then by 6 p.m. or 7 p.m. that should be your dinner. And after your dinner, it's best to avoid having a supper because from 10 p.m. onwards, that's when your body start to go into resting mode. Yeah, you wouldn't want to have any food going in because then that will cause the sugar to go up again.
Yep. Okay.
Yeah, but I know that some people they say that it's very difficult to have like a fixed time for their meal, especially if they are always on the go outside, meet clients, all these things. Yeah, so I say that if possible, try to have a small snack. If you think if you're gonna have a late dinner or late lunch, have a small snack, maybe a few pieces of biscuit, maybe 1 piece of fruit, just to have a bit of sugar going in at a time, so that your body sugar level don't drop too low, and then when your main meal come, at your main meal, your carbohydrate portion should be a smaller one. Yeah. So at least there's some sugar going in, rather than a big breakfast and then suddenly your next meal is at 3 or 4 p.m. Yeah. So you can imagine that big fluctuation in your sugar level, which is not what we want.
Correct. So basically, like what she said, you want your body to constantly have the sugar.
Yeah, going in a controlled portion. Yeah, rather than like a big breakfast, then suddenly lunch you don't have anything going in, then your sugar level start to slump very low. It's like a roller coaster. We want to avoid that roller coaster pattern.
Correct.
Yeah.
Correct. Then, cause for us, we try to tell the patient at least to eat 70% full. Don't eat full, don't be 100%.
Full.
Yeah, full. Then like a plate itself, let's say for example, we have different ways of teaching.
Yes.
I mean her way definitely be very
Rice
more
bowl.
detailed.
Yes.
Yeah, rice bowl. But for my way of teaching how to split your portions for your food itself, basically
your plate.
So you have a plate here.
Yes.
Okay. Then we split the plate into 4 quadrants.
Yes, man.
Okay, so the 4 quadrant itself, one we put the rice. I just put right? Rice 1/4, vegetable 1/4, meat 1/4, and fruits 1/4.
Can.
Like this lah. To her standard, it's definitely fail lah. But this is roughly
your plate lah.
roughly what the patient
can. Actually, it's almost there. It's quite correct. I mean, your quarter should be your rice, then your meat, vegetable. Yeah. But then in terms of the fruit wise, you have to be careful because fruits have sugar also. Yeah.
Correct.
So usually I'll tell people fruits one day 2 feast size. Yeah. You can't have too much of fruits because we had a lot of messages from the government, from the public. We had to eat more fruits and vegetables. But for people with diabetes, fruits have sugar inside, so you can't afford to have too much sugar going in. So usually one day I recommend 2 feast size of fruit. Yeah, if you can fit your fruits into 1 feast, that will be 1 portion. You can have another portion at maybe dinner time. Kashima, you want to say hi to them? Oh, no, that's our clinic assistant. She's watching us. She's very curious about what we're talking about. Yes. Okay, so this is your main meal. This is the quadrant. Lunch and dinner should be like this. Breakfast, I usually don't see people eating this way. But then in breakfast, usually I'll tell people at least have 1 meal a day where you eat something that's healthy or at home. So most people, they will have dinner at home. If they find that lunch and dinner they have no choice but have to eat out, then breakfast should be one of the meals that you should be trying to eat healthy. Could be oats, could be cereals with milk or wholemeal bread, something that is healthy that you can have control of. Yeah. And besides that, sugary drinks, usually that is the first thing that I'll tell people to change. Your soft drinks definitely have to go. Even your sports drink, 100 plus, isotonic drinks, all those drinks, if unless you do extensive exercise run a marathon, you play badminton for 2 hours, football, then you can drink sports drink. But otherwise, if you're gonna exercise just for 1 hour, that sports drink gonna have sugar inside. So whatever you burn in your exercise, you're just gonna replace it in that sports drink Yeah. So if you play extensive sports for more than an hour, then you can have a bit of sports drink. That's okay. Yeah. And besides that, your 3-in-1 coffee. I know you like 3-in-1. I also quite like 3-in-1.
It's convenient and
it's cheap. Convenient and it's cheap and it tastes good Yeah. But then for people with diabetes, 3-in-1 have sugar inside, so you have to avoid. Ideally should be kopi kosong so no sugar inside. That would be the best. But if you find it really very hard to avoid like sugar in your drinks, then I'll tell people you go and look for those 3-in-1 coffee that have lesser sugar inside.
Okay.
Or instead of having 1 packet, you just have half a packet just for a bit of taste
But half the packet with more water?
It don't taste nice. Don't
okay.
Taste nice Some people actually tell me, I have 1 packet of 3-in-1, I just add a lot of hot water inside. It doesn't matter because the sugar is still the same. The content is still the same.
That's a good one because they say, doctor, if let's say I were to put 1 packet in and a lot of water, will it make a difference? You dilute, but the thing is, if you finish the whole thing,
all the sugar is still going.
It's still the same amount of sugar
Yeah. You're just gonna pee out more urine. That's all only. But the sugar still lingers.
Correct.
So sugary drinks. So 3-in-1, bubble tea, soft drinks, fruit juice also. People tell me, I don't take fruits, but I drink fruit juice. Definitely cannot.
Correct.
Because fruit juice itself, imagine if you eat drink 1 cup of fruit juice, you have like 3 oranges going in. I ask you to eat 3 oranges. Can you eat 3 oranges at one go? Can really?
Sure can.
You can. I can't, I eat 1 orange, I want to die already because it's very filling for me. So you can see people when they eat like 1 or 2 oranges, it's quite filling for them. But if they drink 1 cup of orange juice, that's like 3 oranges going in. It's very easy to drink and you don't get full.
Okay.
So you can imagine that 3 oranges, the amount of sugar is almost about 1 bowl of rice really.
How many again? How many?
3 oranges is about 1 bowl of rice. I give you 1 bowl of rice, you get full. I ask you to drink 1 cup of orange juice, will you get full? No, right?
No.
So you see, so why people say, avoid eating rice or this, that's bullshit. Really, sorry for the vulgarity. Bullshit. You can eat rice, and rice can fill you up. Just that you really have to avoid the sugary drinks.
Okay.
Usually for most people, 1 bowl of rice for each meal is sufficient really. Unless you do like if you are athletes, like you play badminton and you're a badminton player, you can afford to have 2 bowls of rice. It's okay because you're going to burn it all off in your exercise. But if you're just like us office people who don't really do much of manual work most of the time, then 1 bowl of rice is sufficient for 1 meal.
Okay.
That's why I always get very upset when those newspaper or media hype up and say that cannot eat rice, it's evil and there's a lot of sugar. It's really, it's 1 bowl of rice, it won't do much of harm to us. It's mainly the sugary drinks, and if we are always sitting down and not doing exercise, those are the killers for us.
Okay. Yeah. Alright. Oh yeah, one more thing. I just thought when you say fruit juice, right?
Yes.
Remember, let's say if you go to cold storage or whatever, then there's 2 major type of fruit stuff. Basically, there's fruit drink and fruit juice. Don't be fooled by it. If it's fruit drink, it's basically
cordial.
Yeah, cordial. If it's fruit juice, it's fruit juice. Yeah.
But even fruit juice also there's a few types.
Oh, okay.
Yeah. So fruit juice, there's those that is without the pulps.
Okay.
And then some of them like certain brand I don't want to say out, they'll add some pulps just to make you happy. And there are those that is really very cloudy. That when you drink, it's like there's a lot of like fibrous fruits inside.
So that one good, right?
That's the best, man.
That's the best.
If you
must be cloudy.
Yeah, cloudy. So if you do your own fruit juice at home, remember when you juice them up, if you have the pulps, remember to pour back the pulps and drink that pulps.
Okay.
Yeah, otherwise if you're just gonna drink the juice itself, it's just gonna be sugar. Yeah, you're just drinking sugar water. Yeah. So if you do juice at home, I always tell people if you buy the blender, if you're gonna separate the juice and the pulps, right? Remember the pulps just add back. Most people just give me a very disgusting look. That's why I buy a blender, just to separate the juice and the pulps. But the pulps is the one that's going to give you all the fiber, and this fiber is the one that's going to slow down the peak in your sugar.
Science. Yeah. Okay. Oh yeah. just I wanted to say something. I suddenly can't remember.
Yes, fruit juice. Okay, never mind. Just continue to think.
Okay, never mind. You continue talking.
So besides that, in terms of
yeah.
yes,
Question.
yes.
I always get asked one.
What?
They always say, right, doctor, should I eat the fruits before my meal or after my meal? I'm pretty sure mother will say something about it also, right?
Depends on the culture.
Okay, so let me ask you, right, how would you advise this?
Okay, for people with gastric problem, usually I'll tell them to eat after their meal.
Okay.
Yeah, because fruits, they are acidic in nature.
Okay.
Yeah,
okay,
so
fair,
for people with gastric problem, they say that if they take fruits, then they'll have stomach churning because a lot of stomach acid inside, and if you eat fruits, then there'll be more acid going in. So for people with gastric problem, I'll tell them to eat after meal.
Okay.
But for people who are watching their weight, like trying to bring down their weight, or they are watching their sugar level, I'll tell them to eat a piece of fruit to fill them up a little bit. So when the time comes for their main meal, they won't eat as much rice or as much of meat. So the portion of their main meal is smaller. So that fruit is actually more of like to fill out your stomach a little bit first.
Satiety.
Yes,
satiety.
That feeling.
That feeling.
Yes.
Okay.
But for people with like maybe gastric problem, I'll tell them to eat after meal because their stomach just can't manage the acid in the fruits now.
Good. Okay, so what she mentioned is before you eat your meal, you take fruits, you can eat less.
Satiety. It fills you up a little bit. Yes.
After, maybe if you, let's say you have gastric problem.
Yeah.
Okay, but let's say in terms of absorbing that vitamins, right, before, after, honestly, right, it doesn't matter.
No difference now.
Yeah, the mother will tell you, maybe you eat before or after, but it doesn't matter. As long as you eat fruits.
Yes.
Yeah, take everything to into proportion lah. Don't overeat everything lah.
Because fruits, I tell them earlier, like you have to have 2 feast size lah. As long as you can fit into your feast, 2 feast size of fruits a day is enough already.
Okay.
Yeah, there are people that, especially grapes. I tell you, when they say I do like grapes, then I ask them how many grapes you eat. Sorry, I don't count. I just take like 1 packet, like 1 kilo, and then I'll just eat in front of the TV. That's like maybe like your quota for 3 days, of fruits already. Because fruits have sugar, so definitely if you have diabetes or even pre-diabetes, okay, this pre-diabetes is something that is a silent thing because pre-diabetes, yes. Yeah. So it's when your sugar level is higher than normal, but it's not high enough for you to be diabetes, and that is actually a warning sign for most people. Yeah, alarm bell that if you have pre-diabetes, you better control your sugar level. Otherwise, it will progress to full-fledged diabetes.
Correct. Yeah, I saw, not recently lah, maybe earlier this year, they have advertisement on Singapore. Yeah, the one where they say pre-diabetes can be prevented.
Yes.
Yeah, so like what we mentioned now, if you, let's say you take your sugar and you enter to the phase where you're in between diabetes and non-diabetic, that will be the pre-diabetic level lah. If you ask me the level itself, it's between 5.6 to 7.8 lah. Fasting, 7 to 8 hours, but the numbers not important. Main thing is to prevent it lah.
To prevent it from going to the full-blown diabetes.
So our last part is the pre-diabetic part itself. Who are the people who has that risk itself? There's actually a way of calculating it. There's one thing called metabolic syndrome. Yeah, metabolic syndrome, very cheap one. Okay, but the thing is, metabolic syndrome is where your waist circumference, for us Asian, for female, how much?
It's 30 inch and below.
30 inch and below lah. That's about how many centimeter?
80 cm.
For male?
Yeah. For male is 35 inch and below. It's about 85 cm.
85 centimeters. So let's say if you measure yourself, you're more than 85 centimeters for male, 80
for ladies.
Yeah, you have one small wrist. Okay, then there'll be like a high cholesterol level, low bad cholesterol, high triglyceride. This one not important lah. Just basically high cholesterol.
Yes.
If you are you have blood pressure, and you have high in sugar, you fall into this category called metabolic syndrome, where you are at risk of having diabetes lah. Simple as that lah. Okay, that's not too.
That is quite scary because every time when I see doctor write that metabolic syndrome, I'll be like, oh my god, like this patient have all this thing here, and usually if you control your diet and your weight, usually can tackle all these 4 issues.
Correct.
Yes.
Yep. Yeah. So your doctor will, So your doctor will take your blood, which is important to know whether you're at high risk or not. They will measure your blood pressure, measure your sugar, then your measure of circumference.
And your weight also lah, because we usually use BMI also, body mass index.
Mm.
So if you fall into the overweight and above, or if your waist circumference, I notice a lot of young people now, because they are always sitting down, they tend to develop like higher waist circumference because of the position they sit. Yeah, yes, you're falling in front, then you don't agree with that. Okay, never mind. You don't agree with that.
Different point of view lah. Different point of view. But what's important is diabetes part lah. It's okay. It's okay.
Yeah. So if you're on the overweight or obese side of things, and if you have higher waist circumference, and if you do a blood test, usually how old and above you recommend people to do a blood test really?
Actually, more than 25 years old, more than 45 years old is a must. So more than 25 years old, I would say every once a year, twice a year, yearly lah.
Yeah.
Yearly itself, because you never know.
Yes.
Blood pressure, sugar, HIV, STD, cholesterol, thyroid. Basically, a lot of things can be screened. So many times the first symptoms coming out is actually from the blood, not symptoms. The first sign.
The first sign.
First,
you look at the blood.
the blood itself. The blood will show some problem. Because by the time you feel that you cannot see it, it's a bit too late. So
Yes.
of course, family history, having high risk, you should go and see a doctor also. But to be safe, every once a year, take a blood. You'll be safe. You'll be better lah. Yeah.
And our eye machine here, what can they check? I mean, I do notice some of our patients coming here to do their eye checkup. Is it?
Okay, yes. So let's say, for example, if you are newly diagnosed diabetes, it's a must to do a fundoscopy. Basically, it's the eye machine. It's basically a camera or machine which will take a picture of your eyeball. Inside the eyeball itself, the fundus, where you can see all those veins, all those discs and stuff.
Blood vessels.
Yeah. So that one is to see if you are having any eye damage, which is called retinopathy, which is usually caused by diabetes.
Yes.
Yeah, it can be other things like glaucoma, whatsoever.
High blood pressure, all this.
Yeah. So it's important. So let's say you're newly diagnosed, the doctor will definitely ask you to do fundoscopy. If you are a certain age itself, the doctor will ask you to go and do a fundoscopy every 2 to 3 years. Yeah. So that's basically the fundoscopy lah.
Yeah. And also I do have patients that come and ask me also like, every time when they go to the toilet to urinate, and then they notice that there's a lot of bubbles in their urine. Is that a sign of like kidney problem?
Okay. Okay. Usually, if let's say there is bubbles in the urine, it can be because of sugar. It can be because of protein. Or it can be because, I won't say the thing you eat, but let's say if there's bubbles, it would be best maybe you should go and see a doctor to get the urine test out.
Urine test also.
Yeah.
So urine test can also tell us a lot of things.
Correct.
Whether there's any leakage in the sugar,
Correct.
protein, because ideally our kidney shouldn't be leaking either of these, right?
So so let's say why you always take blood and doctor asks you to take urine
test.
is because let's say before your blood even shows problem, the first thing that goes off also is actually your urine. So let's say there is protein, sugar or blood, that can cause problem now.
Because usually our kidney in the optimal state shouldn't be actually leaking out sugar or even protein.
Correct.
Yeah.
Oh yes, one more thing. Have you seen or your friends ask you when you pee then you stain the toilet bowl and then the ants go there?
Oh my god, that's like my grandma generation. That's usually last time, older generation, before they even know about all these tests. The first sign of diabetes is usually there's a lot of ants going to the urine.
Correct. Yeah, because the urine in a diabetic patient who is poorly controlled, the urine is so sweet, the ants also can go there and feed on the urine.
The sugar.
So you have such complaints, you hear it, go and see a doctor too. Or go and see a nutritionist.
Or even if I do see patients that within a month they lost like 10 kg because all this sugar that is meant for the body to use is not being utilized. It's actually leaking out in the urine. Hence they lost a lot of weight in that 1 month. For most people, like ladies, they'll say, quite happy they can lose a lot of weight. But actually that's not a very good sign because it could mean that you have diabetes. It also could mean that there's some issue going on. You have some thyroid problem or even like cancer that can actually cause your weight to drop drastically. So usually if your weight drop drastically, like maybe 10 kg or more, and you have no problem with eating, appetite still normal, everything still okay, it's best that you actually go and see a doctor because it'll be good to know what's going on. But for diabetes, usually I'll recommend people please come and see a dietitian, because we do know that besides controlling your carbohydrate or your starch portion, there's a lot of things that actually contribute to your diet. The food that you eat, although maybe not high in starch or carbohydrate, we do know that this food can actually get converted into sugar. So if the portion size of those food is actually not in the ideal or right size, it can actually cause your diabetes to worsen or even not come down. Okay, so if there are any questions from the audience that you want to know more about diabetes or any issues, I will leave it open for the next few minutes, because for the past 20 minutes or so we have been talking, but we also like to know from the audience if there's any other questions that we have not covered, or you'd like to ask, please do so in the comment. We have a few minutes for you all to do so lah. Okay, so in the meantime I'll just start waving at the people. Let's see,
Just now I tried to scroll up, but then there was too many.
Too many, yeah. This is a very good topic, because people do have people they know they have diabetes lah. Oh yeah, and by the way, when patients they are on medications already, and if their sugar level is under good control,
Yeah, okay.
is there a chance for them to actually stop their medications? Have you ever seen patients that are so well controlled in their diabetes, they control their diet, their lifestyle, to the point that they don't even need medicine already? Have you ever encountered that case?
Okay. So they will say people one more myth. Basically, the patient always tell me, hey, if you take medication now, then you are forever dependent on it. That's bullshit. Okay, really bullshit. Let's say, for example, the two of us has no diabetes, we take the medication itself, our sugar will just go very low. But then we can even take it for 1 month and we feel dizzy and stuff. But 1 month later, we don't take it, we'll be back to normal. Yeah, so don't listen to the myth where they say you take your diabetic medication, you are forever dependent. It applies to hypertension, cholesterol, everything Yeah. So okay, you're back to your question. You said something about
once their sugar level is under control, is there a chance that doctor will just cut down their dose, or even like, hey, your diabetes is so well controlled, you don't need medicine anymore?
Okay, so there will be patients where they really, really control very well.
Very motivated.
They control very well. So what happens is, some patients, they actually don't take the medication after that. Then they monitor themselves. And they write it down, then they show it to me. Then it's actually very good. Then what we'll do is we'll take a blood called a HbA1c. So it will show you 3 months of your average sugar level. If let's say it's really good, we can ask him to continue the lifestyle, not take the medication, and we will monitor him very closely, before all these doctors start scolding me.
Okay, so they will come how often to check their sugar level here, the HbA1c?
They can check themselves actually.
Okay.
Yeah, let's say if it's very out of range itself, they'll come back to me.
Okay.
Okay, if they don't have the machine, they can come back here just to take the sugar every day. Then let's say this past 2-3 weeks itself is very good, maybe we can off the medication. But the cases are very low and slim. Very few cases. Yeah, there are very few basically, because your body can't create insulin, you really can't control insulin. Most of the patients, they will decrease their doses to, if it's very well controlled, they will will minus off the medication and if it's still well controlled, maybe they can take it in less dose or every other day. So but the cases are very slim. Once your body can't control your sugar, you drink what or eat what might be high low.
It's a bit like our car like that, right? I mean, once you go in, if you go into accident, your car, you can repair the car, but sometimes you get a bit jerky, because the damage is already done. You can't expect the car to actually go back to its original form or state. So the dose of the medications will just go down. It's more of like maintaining, giving you a little bit of help to bring down the sugar. So that would actually be a very strong motivating goal for people. You know that you can actually control diabetes. You don't even need so many medications to help you control, as long as you are disciplined enough in terms of your exercise, your diet, you take care, then smoking, alcohol, all these you avoid or even cut down, and your sugar level is sweet, very nice, then you don't need so many medications to support or even help you. Okay.
Okay lah.
So
Yep.
So we just end for today. Yeah. So if you have any questions to ask about diabetes, our clinic Dr. Henry and me, your dietitian Joyce, we are always here to help you because we do want to see you controlling your diabetes well. Because we don't want you to come to see us every time. We just add on medication, add on to the point that one day you had to start insulin. And you have this misconception that once I have diabetes gone case, my road ahead is just going down. It's not.
Okay. Well controlled, you can live as long as anyone.
And you can avoid the complications as long as possible. So. Okay.
Alright.
So thank you for joining us today. So if you have any comments or questions about diabetes, do fill it up in the comment section. We will answer them when we can. And do like, share, and maybe we'll load this video up on our YouTube channel. So you can also encourage your friends to actually come and listen and understand more about diabetes.
Okay.
Right.
Okay.
So enjoy your lunch.
Bye.
Portion control. Okay.
Okay.
Bye bye.